See how he's rolling his eyes? What his eyes tell me is, I really don't know what you're doing, man, but I trust you.
Trust. It's something that has to go both ways when you make a living filing, pulling, and otherwise horsing around inside a mouth with teeth like this.
My name's David Butts. I am an equine dentist, and I've been doing that full-time for just about 30 years.
Equine dentists don't clean teeth, and they don't fill many cavities. In fact, a noble steed's dental needs are truly a horse of a different color.
A horse needs a dentist because in the process of chewing, their teeth get very sharp edges. And those edges can get so sharp that they will lacerate their cheeks or their tongue.
David files down those sharp edges, keeping horses out of pain and easier for riders to control.
If they are not comfortable, they will resist whatever the rider asks them with their hands.
It's so important, David rarely cancels an appointment. Lessons don't stop here at Ship's Quarters Farm in Carroll County, and neither does the dentist.
Hey, guy.
That's Donna Ruth.
You brought your assistant.
Her Westminster farm is home to about 24 horses. Each one has a mouthful of molars that requires David's expert attention and a car stocked with specialized equipment.
In case I have to pull a tooth. The horse we're going to do is 4, and he'll have baby teeth. If he still has baby teeth, I'll have to take him out.
Most of the time, David chooses to work on horses without sedating them. That means he's gotten really good at reading their body language.
When I walk into the stall, I will go in the door and stop and watch the horse. I will approach it with my hand, put my hand on it, and hold it still. I won't pat it. That reassures the horse. I've been doing it long enough that I'm very comfortable. If I look at a horse, I pretty much can tell whether this is going to be an easy thing or not. Then I open their lips, look at their teeth, and this is how you tell how old they are. And actually he does have a couple of baby teeth there that'll have to come out today. This is a speculum, an oral speculum.
David puts on a special bridle that lets him stick his arm all the way back inside the horse's mouth as he files each and every tooth until it's nice and smooth.
And as you can see, they don't really mind it.
And remember those baby teeth?
It's stuck. Here's the adult tooth coming in, the big one, a little tiny one between there. And there's another baby one right there. And he's bleeding because I tried to wiggle it out before. And now I'm going to pull it out. See, that's not a very big tooth.
David admits not all his patients have this much patience.
Not all of them are this good, but most of them do very well.
He sees about 10 horses a day, each one a different challenge.
And he's got a little plaque on these canines.
He can't see much, so he's got to rely on what he can feel.
He loves the horses, and he just has a innate sense of how to work with them so that the dentistry can be done without a lot of anxiety on anybody's part.
In a few hours, the job's done. David heads home to his own horse farm, Windy Willow's farm outside of Libertytown. Here, 18 horses roam a landscape that manages to be picturesque even in the heart of winter.
But because they live here in groups, they get along better. I always say they're like an amoeba. You take one out and the amoeba's missing something.
In that way, maybe, you could consider David one of the herd. As for David, he just considers himself lucky.
Since I was a young man, I've been able to do what I want to make a living.